Have you ever wondered why you're taking all of these iron pills and your iron levels never go up higher? Today, I'm going to talk to you about 5 surprising reasons why you may have low iron. Hi, I'm Stephanie, aka The Healthy Practitioner. Welcome to my YouTube channel, where we talk health, wellness, and all things detox. So 5 reasons why our iron always seems to be low. And it may not be what you expect. You go to your provider, they run labs, they tell you you have low hemoglobin, take some iron pills, and we'll see you next year. Do you ever wonder why you have low iron to begin with? You take these pills, they make your gut feel like junk, they make you constipated half of the time, and you still aren't feeling better, and it's not correcting itself. They blame it on heavy periods, which could be justified, but there may be other causes that are causing your low hemoglobin, iron, and ferritin in your body. I work with integrative cancer patients, and 99% of the time when they have low hemoglobin levels, I do not recommend that they get any sort of iron at all. We look at their ferritin levels. Usually their ferritin, which is our iron storage marker, is usually off the roof. And that's because there's a fire in their body. When there's high ferritin, there's oxidative stress happening in the body. When we put more iron into the body, which is an oxidative stressor, it just creates more fire and more distress in the body. So it's not always the answer. And that's why today we're going to talk about what's deeper. People come into our clinic all of the time and they say, hey, I went to my doc, I had my hemoglobin checked, it's low, I need an iron infusion. I always have them give me an iron and ferritin report to see where they're actually at. Their iron is overall the iron in their body, and the ferritin is the iron that's in storage or should be in storage. And typically those are normal. So I tell the patient, it's not iron that's causing your issues. And they're coming in with valid reasons. They have fatigue, low energy, and they're just feeling off in their body, but it's not because of the iron. The first reason, you might have underlying infections. H. pylori, E. coli, parasites, candida, TB, all have the ability to decrease absorption of iron in the body. So when we see low iron, I'm always thinking about, is there an underlying infection going on that we need to help heal? The second surprising reason that iron is always low in your body is low stomach acid. When there's low stomach acid in the body, there's an increased risk for H. pylori or other gut infections, increased stress, and decreased mineralization of the body. So when our minerals are imbalanced, that includes iron absorption. So I like to tell people, like the use of PPIs, omeprazole, in those type of drugs, or H2 blockers like your Pepcid, they decrease stomach acid. Oftentimes, our body actually needs more HCl or more helpful acid in the body, but we're suppressing it. So when people are eating food and we're taking these drugs to decrease the stomach acid, it's actually turning the acid into like tomato juice, for instance. So like just imagine a burger going into the gut and tomato juice trying to break it up versus the car acid that it should be. Again, this is just generalization, but just imagine what a car acid would do to a burger versus tomato juice, right? We want our body to break down food, to also break down minerals, to help with absorption of the body. So when that acid level is low and off, we have increased risk for iron malabsorption. The third reason you may be struggling with low iron is estrogen dominance. Estrogen has different pathways that it detoxifies and recycles throughout the body. The bad estrogen, the estrogen that's most unwanted, we try to recycle through the liver and get rid of it through different means with bowels and other detoxification pathways. When estrogen is not broken up properly or the liver is not converting it because it has some sort of dysfunction, there's increased estrogen levels in the body, which causes estrogen dominance, which leads to heavier periods. When there's heavier periods, we obviously have low iron. So this is the situation where when women come in and they really are struggling because they have super heavy periods, I do give them iron to support their system. But that's under the understanding that they need to dig further and heal their hormones. So they need to find a way, check their labs, support their hormones, support their detoxification systems so that they're detoxing their estrogen properly and that they're not having those heavy periods requiring iron. The fourth reason is liver dysfunction. So I talked a little bit about that in the estrogen dominance, but also the liver is in charge of releasing a hormone called hepcidin. Hepcidin is in charge of converting iron and ferritin. So when the liver is not working properly, the iron gets stuck in the cells and doesn't get allowed to go into the bloodstream to the necessary tissues. So we hear a lot about fatty liver disease, boggy livers that are not working properly, and that's because we're putting a lot of toxins in our body and our liver is working really hard to try to compensate, but it just can't keep up with that. Things like PCOS can also cause fatty liver because of the insulin resistance and different mechanisms like that. But what we really want to do is try to clean up the liver so that it is working properly and that the hormones that are residing in there are able to function properly. Another thing about the liver is emotions. So if you tend to err on the side of anger, you notice that things just make you angry easily, look at your liver health because the emotion of anger is often stored in our liver. So if you have a lot of anger and you know who you are, check your liver function and make sure that your body is detoxifying properly. Okay, lastly, you can be low on essential minerals and vitamins. Biotin, which is an essential B vitamin found in things like sunflower seeds, whole eggs, almonds, spinach, sweet potatoes, or you can get them through infusions or in supplementation. It is necessary to convert the iron to ferritin. So when we have iron in the body, we want to store it so that we can use it when needed. And without that proper biotin in the body, the enzymatic process cannot occur. So those are the 5 surprising reasons why your iron might be low. This is a good indication if you do struggle with low iron, get your blood work tested. Do an overall picture, look at your hormones, look at your inflammation, look at your vitamin D, look at all of the markers in your body that can be causing an imbalance. Look at how you're detoxifying. Are you having bowel movements every day? Do you have a lot of acne or things that are showing your gut might be inflamed? So we can get to the root cause and eventually your iron will be good, your hemoglobin will be good, and you'll be feeling really good. Thanks for tuning in to the Healthy Practitioner YouTube channel. I can't wait to see you again soon. Have a good day.